Epilepsy is one of the most common neurological disorders. Doctors say affect about 3% of the global population. Here in Kenya, they estimate that 20 out of every 1,000 people live with this condition. My name is Gloria Milimu, and in this episode of Health Digest, we tell you why doctors insist on proper diagnosis and treatment in management of this condition. Meshak Okonji, an accountant by profession from Nairobi, is among an estimated 1 million people living with epilepsy in Kenya. As he takes on his daily chores at his place of work, the events of 1997 that would later see him live with a lifelong condition remain vivid in his mind.
It was in 1987 when I was a second year at University of Nairobi. That's when I started having funny behavior, standing when the lecture is going on and walking around and making noise. And then I was taken to Kenyatta, and then the brain waves were checked. And then I was told by the doctors I have epilepsy.
The 52-year-old tells me his diagnosis with epilepsy, a neurological disorder caused by abnormal electrical signals in the brain, came as a shock.
It really hit me very, very badly because it was something which was just, I didn't expect something like that on my life. So first I was really stressed. I went home annoyed. I just started asking my mother why she gave birth to me. Then I told her everything. I just asked her where will I get employment when I finish university, who will decide to be my wife. But then my mother just told me to cool down. And then I decided to cool down. Then I continued with my education. And then I can say God is the one who provided the way.
Meshak was not spared the stigma and discrimination often faced by people living with epilepsy, a situation doctors say is compounded by lack of awareness about the disease.
I'm a lawyer. Then I came to notice that lawyers in this issue of epilepsy, they really take it very, very badly. Because the time I went up country, they received a rumor that I have epilepsy. Even people shaking my hands was difficult, they didn't want. But since I was in this association, I was really strong enough and I knew that is just something small. Because there they believe when you have this epilepsy, maybe you have been cursed or you're not supposed even to be near other people. But me, I just said there's no problem. This particular disease, the main issue about it, if you want to capture it and continue the life, the first thing you have to do is accept you have it and you're ready to continue on with life. Even there, the tablets will work. But if you still take tablets and you have the conscience of, let's say, you're asking yourself, why did I get it? Or what can I do to get healed? The tablets cannot help. But you have just to accept you have it and continue on with life. And that's the way that I've just been.
More often than not, people diagnosed with epilepsy would put their career ambitions on hold due to fear of victimization and low self-esteem as a result of this condition. However, for Meshak, who graduated with a bachelor's degree in statistics, not even the condition was going to deter him from pursuing his dream that was almost cut short by one of the employers after he disclosed that he had epilepsy.
The first time I got one job after 2 years, I did an interview and I passed the interview. Then I had not told the employer that I was epileptic, but then when he was showing me around the office, I told him there's one medical issue I have to tell you about myself. I told him I'm epileptic, but it's under control. Now that employer just told me, I'm sorry, you'll start working tomorrow. I'll just write for you a letter when you'll come. Then I just knew that one I'm sacked. But since I was already in that association of KAWE, I was strong enough. I didn't have that stress very much. I just went home.
This discrimination, experts say, often has an impact on the quality of life for patients living with epilepsy. In the outskirts of Nairobi, we meet yet another patient living with epilepsy. 35-year-old Lucy Nduta from Dagoretti Gashui has cared for her 12-year-old sister who was diagnosed with this condition at the age of 2.
Dorcas ni dada yangu mdogo ambaye after mama yangu kumzaa akakaa naye kama miezi 2 akakufa. Mama yangu alikuwa na kansa ya kichwa. Sasa venye Dorcas alizaliwa tukamlea kukaa kama miaka 2 hivi, Dorcas akaanza kuanguka alikuwa anaanguka, anakuwa na controversy na anatoa pofu kwa mdomo. Sasa tukachukua step, tukaanza kumpeleka hosi.
For the last 10 years, Lucy, who is the eldest child in a family of 5 children, has played the role of a sister and a mother to her younger sibling, whom she says need care and love. Though she intimates that the journey has not been an easy one, as her sister has also had her fair share of discrimination.
Ndio tumekaa hapa kwa muda mrefu. So Dorcas kwa hii community wamemchukua tu, wamemuelewa, hata wakipata ameanguka at least wanamsaidia. Kwa society wanamchukulia vizuri. Although kuna wengine wanasema, "Oh, unaona amejikojolea, usivuke hiyo makojo yake, unaweza pata kifafa." Which is not good. Yake ni ile kujikojolea. So kwa expenses za nafua sana makojo yake. Paka saa zingine namuulizanga Dorcas, kweli is it true umeshikwa na kifafa ama umejikojolea tu? Juu saa zingine anajikojolea tu hivi kama amesimama, but I understand her.
Dr. Osman Miyanji, a pediatric neurologist, says seizures can vary from the brief lapses of attention or muscle jerks to severe and prolonged convulsions.
The convulsive ones are easier to see because these are now what we normally refer to as, in our settings, as kifafa. Everybody knows kifafa. Kifafa are when your body is jerking, you have a stiffness of your body and you lost consciousness, and you are frothing, irregular signs of real epilepsy that people think about. But epilepsy is not only that. These are what we call the generalized seizures. In the old days, we used to call them grand mal seizures. And these are now, anybody can report on it.
For 12-year-old Dorcas, the injuries sustained during some of the episodes are a clear testament of the toll the disease has had on her. And in a bid to minimize her head injuries, Lucy says she has to ensure that Dorcas wears a plastic helmet to school.
There are other types. The spectrum is very big, from very minor seizures. Minor seizures may not be visible because you may blank out for a few seconds. Okay? Those we refer to as absence seizures. There may be some motor activity, but mostly they just go blank, and it's just for a few seconds. That's now the other one end of the spectrum. Very minor, which you can have hundreds of them, but you may feel that they are just daydreaming. Or in a class, they may just go look at blank at you and then suddenly wake up and continue with their activities. They don't fall down, they do nothing. Then there are others where, again, we put it under the non-convulsive type, where you just show changes in your behavior, that you are now not yourself. You know, you've lost full awareness, you're confused, your behavior, you're doing certain movements and things like that, which people may not be aware that is an epileptic seizure.
While the condition is manageable, healthcare providers are still not as well trained on epilepsy as expected.
Training is very important. So you train those people, say right from the grassroots levels, primary healthcare workers, community health nurses, because they, at that level, they are the ones who are treating. Okay? We don't have enough doctors either. Forget about neurologists. We don't have enough doctors. So now if you ask them now to treat these people, but you have to first train them. Now, on a wider scale, you see, now if you first train, then supply the drugs, the facilities available, people will come to you.
Dr. Osman advocates for their training to ensure patients get the necessary help required.
The current training we do, we only do training in batches of 30, 40 at a time. Okay? Maximum we can train in a year is about a few hundred. Okay? That's not enough. I mean, we're looking at the whole country. We have done a lot already. We have trained thousands of them already. But now without that training, you see now when they're better prepared to go there. Besides the KMTC, even the medical schools have to improve their curriculum for epilepsy.
And in an effort to reduce treatment gap by making medicines available and scaling up advocacy and awareness creation, organizations like the Kenya Association for Welfare of People with Epilepsy, KAWE, which is a non-profit organization, seeks to address challenges that people with epilepsy experience.
One of the another tragedies in our society and in our medical field, I sometimes blame our own medical people who tend to, tell people that, epilepsy is very expensive to treat. And this is now medication part of it, okay? I'm not looking at the investigation part of it. The medication alone. Now, medication, it is not true, it is expensive. It can be treated in a very affordable way. Our organization, which is KAWE, which is a non-profit making NGO, we have shown over the years, and now we have even shared our knowledge with all the African compatriots and our African colleagues, plus internationally, all the international bodies have been there presenting all these figures. I mean, you can treat an epilepsy patient now with about $5 a month, which is only 500 shillings a month. Okay? We at one time we could even treat them for 200 shillings, which is $2. Unfortunately, the prices have gone up now, but still, it depends on the choice of medications. If you use the modern and the expensive branded products, they're very, very expensive. At the moment, let's face it, we have so many generics that are available of the same product and good reputable generics, okay? And now in Kenya, we have many, and it's not just one single one, there's a huge choice. So, and then now we have exactly a practical experience from our KAWE, okay? We choose these drugs, we buy them in bulk, okay, and they don't cost us very much.
Dr. Miyanji says that there is an 80% treatment gap for people living with epilepsy. This means that only 20% of people are on appropriate treatment to manage epilepsy, while the rest could be suffering not knowing that their condition can be managed for them to live a fulfilling life.
We deal with poor people, KAWE, and we encourage them to use drugs that are affordable, and then there will be better compliance. Otherwise, the more expensive drugs you give them, they will only use it for a few days, and they say, no, we can't afford it anymore. And then this word gets around. They say, oh, it's so expensive to treat this. We are trying to share our knowledge with people. Like I told you, what we spend, okay? Now, our drugs, for example, what we spend about, like a simple drug like phenobarbital, doesn't cost more than 1 shilling per tablet. 1 shilling. Phenytoin costs about 2 shillings per tablet. Carbamazepine, which is again about maximum of 3 shillings a tablet. Come on, where are we? There's a sodium valproate. These are the common recommended drugs. We have also produced a book, guidelines for the Ministry of Health, and which gives instructions and training to all the primary healthcare workers. So they also have a list of drugs that they can use. But it's up to the ministry, the government, and the counties to buy these drugs rather than buying the expensive ones. You see, unfortunately, we have no control over that.
Doctors estimate that up to 70% of people living with epilepsy could live seizure-free if properly diagnosed and treated. while a quarter of epileptic cases are preventable. They advise that preventing head injury is the most effective way to prevent post-traumatic epilepsy.
Children, now, for example, children, because now they are dependent on the parents, certain activities, children are children, you know, because they're adventurous, they want to be like other children, they want to participate in all activities. So we tell them to allow them to have as normal a life as possible, okay? But with some provisos and some precautions. Now, some of the precautions we say are again potentially harmful activities. For example, being near a fire. You should never be alone, because most of our problems with epilepsy are burns. You know, people get burnt out so easily. So I advise my patients, the children, of course, eventually they have to learn how to cook and all that, but if it is some heating places, heating implements that they have to use, then they must be accompanied. They should not be alone in the kitchen cooking and boiling water and things like that. They should be with somebody. They should learn how to cook. I'm not saying they should not learn, but avoid, just common sense. Then, any swimming pool. For example, being in a swimming pool alone, no. That is dangerous, okay? Because should he have a seizure, then he can easily drown. Because, so swimming allowed, but supervised swimming. It's very important. Activities like climbing trees, cycling alone, for example, that activities that involve you alone, a solo activity, which is potentially dangerous. You are on the road with a cycle, avoid it. You are trying to climb things, avoid it. So, then what they're allowed to do, they're allowed to do everything but under supervision. But the important thing is that they're allowed to play group games. Like they want to play football, they want to play all the other hockeys, etc. Okay, group games, because there's always somebody around who can help. Even bathroom, I tell them to avoid tub baths, you know, and being alone in a tub. So, shower bath, okay, which is safer. And also, I allow, as they are growing older, they like their privacy, but I tell them to agree with the parents not to lock their bathrooms. Simple, common sense activities, okay? Then you can think of, depending on what your household does, things that are potentially risky, you avoid it. But don't stop them from doing things, because they will not accept that, because they should not feel different.
As children with epilepsy grow up to adulthood, they have to be deliberate in the choice of careers they pick. While Dr. Miyanji recommends that they should venture into any career, there are some that will put them and many other people at risk.
While they are on these drugs, obviously, they are all drugs, intoxicating drugs, you see. All of them have an effect on the brain. So if you combine them with alcohol or any of these intoxicants, or substance abuse, obviously they will have problems, you know, because then they'll go out of control again and end up in ICU or thing like that. This fellow has been to all these cycles, so he would have been a nice, but then unfortunately he was not very comfortable of exposing his problem. You see, he's never done it, but I think he'll get around it. I'll bring him one day. So that is alcohol, then drugs, things like that. And in any profession or activity, that is dangerous to him and to the others. The certain jobs we discourage them from doing. For example, a bus driver or a matatu driver, okay, or a pilot, okay, or anything that you are going to now ask them to look after many people, because should he have a seizure, he'll have a problem, of course. I mean, it's not just him, there are others. So certain jobs that are potentially harmful to him and to others, like dealing with machinery.
Like Meshach Okonji, people living with epilepsy can realize their full potential if the condition is well under control with appropriate and affordable medicine. Gloria Milimu for Health Digest, KTN News. But still to come in Doctor's Diary.
When I came to Nairobi, and that's the first time actually I was like now living in Nairobi, I noted that a number of doctors were having a lot of issues, you know. I think the work that I've done for doctors also speaks for itself, you know.
Nothing will change until you go on the street and protest.